Hello, everyone. A very warm welcome to all of you, and a very good afternoon too. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing good. Today, in this session, we are particularly going to talk about acne management. And talking about acne management is very important because this month, June, the month of June, is dedicated for acne awareness. And acne is something, which deeply impacts our emotions as well. So it's just not superficial, it's just not cosmetic, it's just not related. So it's important to talk about this chronic skin condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. So, in this session, with our skin expert, we'll try to know what exactly acne is, what are the various types, grades, and how we can deal with it. What should be the preventive strategy? What should we do, what should we not do to take care of our skin and keep it acne free. Let me tell you who is our skin expert today. So our skin expert is Dr. Aslam Ahammed, a renowned skin expert from Kochi. Dr. Aslam, the visionary medical head and director at Sage Skin and Hair Kochi, a board certified dermatologist. Dr. Aslam is always at the forefront of cosmetic dermatology in Kochi. Um, he brings a touch of luxury to skincare like no other. With over 5 years of dedicated service, Dr. Aslam has changed the lives of thousands of patients, instilling confidence and radiance through his experience. It's such a pleasure to have you with us, Dr. Aslam. A very warm welcome to you.
Thank you so much. Thank you.
So, Dr. Aslam, today we are going to talk about acne management, and acne is so common, most of us has gone through that phase, especially women. I mean, teenage acne is one thing, adult acne is one thing, then we have so much of hormonal disbalance, etc., etc. And especially people who have oily or acne prone skin, they all know that treating acne and the acne scars and marks is such a big challenge. And it impacts our confidence level as well, our emotional level as well. So it's important to talk about acne. To start with, doctor, what is acne? How is it caused?
Yeah, hi. Thank you so much. So basically, as a dermatologist, 90% or sorry, not 90%, but 70% of your patients will be having acne. So basically, like acne, you can define it as a like very chronic condition, very chronic inflammation of your sebaceous gland. So basically, sebaceous glands are glands which produce sebum or oil that we call, which produce it's predominantly over the face. This serum, like this sebaceous glands, are located mostly on the face, chest, upper back, shoulders, and upper arm, and all those. So basically, acne is a chronic infection or an inflammation, you can say, of that sebaceous glands. Usually occurs in adolescence, but it can occur in late, in after 20 years also. Like it can be a sign of any other underlying conditions also. So it's normal when it is happening like before 19, 20 years. But when it occurs after that, it's probably because it's linked to something else. Yeah.
Okay. Doctor, we see various patterns, many times we see acne on our forehead, many times it's alongside the jawline, in the butterfly area as well. So do they symbolize us something? Do they tell us something?
Yeah, actually, like you cannot say like not completely, but yeah, as you said, yeah, like, some people they tend to get acne over the forehead only. Some people tend to get over the T zone, as we call it, over the nose and cheeks and the forehead, and then some people usually get acne over the jawline. So basically, like when it is in the adolescence, it's mostly over the face. Okay, when it is a late onset acne, it usually happens on the trunk, on the body, on the chest and upper back. So usually when it is associated with some other things like dandruff or retention of other hair products or something like that, so it tends to occur usually on the forehead. So and it'll be like very small bumpy lesions and like that. But when it happens only over the like oily areas of the face, like the T zone of the face, and it's usually the like which is like mostly related to oily skin. So another thing that we see commonly is in females tend to occur mostly over the jawline. When there is a like correlation with PCOS, like polycystic ovarian syndrome, as we call it. So because of these hormonal influences and all those things, it's not a general rule as such, but they tend to occur more on the jawline. Yeah. So the but late onset acne usually, tends to occur both on the face as well as the body, like your upper chest, back, upper arm, things like that. Yeah.
Right. So we all know that keeping good care of our skin is important, but when it is an acne-prone skin, or you have oily skin, or you are a teenager, adolescent, attaining puberty, then it becomes even more important to take care of your skin. But then market is flooded with products, doctor, and influencers on various social media platforms are also endorsing products. We have so many over-the-counter products, so we are so confused what could be a basic, minimalistic, skincare routine that we can follow, all of us can follow, despite our busy schedules.
We even have a campaign which says real care is not real care. So basically the thing is, it depends entirely on your skin type. There's nothing like, you cannot recommend a common product as such. It's the sad truth. You cannot, like, people ask me about like product recommendations, but the thing is, you cannot actually tell properly. You cannot pinpoint a product and you can say that you can use it. Even like we are not confident to do such things, because like many a times, even when we suggest also, like maybe 95% of the time it might be right, but 5% of the time the patient doesn't, feel it right. I mean, the product is not right. So it's basically, it all depends on the skin type. So when you have a very oily skin, for as a general rule, I can say, if you have a very oily skin or something like that, then you have to like control your oiliness. So basically, if you use an oily moisturizer or an oily sunscreen on top of your oily skin, it will generally tend to increase the acne. So if you have very oily skin, you have to use a like very oil controlling gel type cleanser. Okay, then you have to use an oil control moisturizer. Then you have to put a very lightweight sunscreen. So then generally, and don't try to layer too much products if your skin is very oily. That will make it even more, oily, and it'll tend to reject those products. So layering is very important. So depending on your skin. So if you have a very dry skin, there's no point in using a very, oil cleansing cleanser or things like that. So if you have a very dry skin, you have to use some kind of cream based, or very mild cleansers, and like proper moisturizer with ceramides, hyaluronic acid, and all those things. So it completely depends on the skin. So that's why you need to consult a proper dermatologist, and decide on your proper skincare routine, because all this
Right. So
skincare routine also, like,
it can't be
see, like,
generalized. It's
yeah,
individual.
because many people, they tend to use a lot of oil-based things and a lot of powder-based things, because talcum powder is still one of the most abused things in India. So basically, these things cause a lot of eruptions. So yeah,
So we can't generalize these
we
products.
cannot
It's
generalize,
very
right?
individualistic, and you need to go and consult your dermat, a qualified dermat, who will tell you that what would be your skincare routine. And especially if you have any skin condition, be it acne or anything else, please, please, please go for your dermat. Now, doctor, a very common tendency in our society is to apply something on our acne from the kitchen, or from the toiletries. So we tend to apply mask, clay, basin, turmeric, toothpaste,
Yeah.
and only when the condition worsens, that's when we go and land up in front of a doctor. So there are so
Correct.
many other things also. We'll also talk about over-the-counter topical applications, but before that, home remedies. Do they really work, or we need to go and consult a doctor?
Home remedies as such doesn't work, because, as I said, acne has a lot of things. But see, acne is just a symptom. It may not be the actual disease. Okay, acne might be part of something else. It might be PCOS. In females, like, a lot of patients have PCOS and all other symptoms. So all the other conditions are also there. So first of all, like, rather than treating the symptom, you have to find out the root cause of it. Okay. So if you're in your adolescence, yeah, then acne might be just acne. But if you're like somewhere like 20, 30 and above that, when you're getting acne, there's no point in using any home remedies, because you have to find out what caused acne. Okay. So for that, you need an expert, like, assistance. And the thing with all the home remedies is that, many of the people are allergic to a lot of things that we use at home. Okay. Like contact dermatitis is one very common thing, like even if it is turmeric also, it's very like some people, tend to get a lot of allergic reactions to it. So it's definitely like not recommended to use all those things. And when you get acne, usually like when it is in your 20s or 30s, when it is late onset acne, you have to get an medical advice regarding that.
Absolutely, and same, as you said, it's important to diagnose the root cause. The influencers over the social media, the over-the-counter chemist shop, the chemist wale bhaiya, they are equally not going to diagnose our issue, but still we go to them. It's again a very common tradition to go to our chemist shop or go by what the influencers are saying over various social media platforms. Take the topical application cream tube, whatever, and we start applying them.
Yes.
Initially, they work
Yes,
wonderfully,
there's one important
and
thing
then
that,
we
like as you
forget.
mentioned, like in topic, like when you're getting things from pharmacy or whitening creams and all those things are really important nowadays because most of the creams contain steroids and you abuse it for a lot of days and then you end up having acne. So basically, like one of the reasons for you to get acne is maybe the use of whitening creams and all those things. So that also is there. Yeah.
Mhm. And when a person is applying over-the-counter topical applications for acne, because we go because chemist shops are so easily accessible and easily available that we go there, we get those creams, and as you said, they contain steroids, and we start applying it on our acne. Now, initially they work wonderfully. We'll see that
Yeah.
our acne has reduced, our skin is glowing, etc., etc. After a certain amount of time, we realize that we are addicted for that cream. Our skin has become addictive for that cream, and then the other problems also rises. How difficult it is to treat a person who was initially an acne patient, but now with all the topical application had made the condition even more worse.
The worst thing is like when the patient has applied over-the-counter steroid creams. The steroids basically are what they do is initially they give you good results because they tend to, kind of what you say, like it tends to take away the like large part of the skin. So there'll be like thinning of skin which is happening. So basically, initially they get a good results, but then the skin becomes very like as you said, like kind of addicted to it. Okay, so basically the acne, which is because of all those things, are very difficult to treat because you have to give time for the skin to recover. So those things are like it'll take few months, even like few weeks to few months. So basically, like over the counter, any other things might not be as dangerous as using like very potent steroids or things like that, but it's better to avoid, because even the treatment of acne is like very different for different people. So depending on the grades of acne, the treatment differs. Okay, so if you have a very mild acne, we use something. If you have very severe acne, we have to use oral tablets and things like that. So there is nothing like, if you have acne, you can use this cream. There's nothing like that. The treatment differs according to the grade of acne. So it entirely depends on what kind of acne do you have, what grade of acne, what kind of severity do you have. So it all depends on a lot of things. So basically, you cannot just go there and buy something and apply for acne. It doesn't work like that.
Fair enough. And as you said, it's important to see what grade of acne it is and then set the line of treatment. Now, what are the various grades of acne? Because as a layman, we know, whiteheads, blackheads,
Yeah.
then there are acne that's painful. So, what are the various grades, doctors?
Okay. So basically, like for the clinical purpose, we like grade it in grade one, grade two, grade three, grade four. So basically, grade one, when we call it like comedons. Those are the small bumps that you can see, like without the pus and everything. So basically, those are comedons, and the large ones are called papules. So basically, the grade one is mainly those small, bumps that you see over the skin. Grade two is when you have little bigger bumps. Okay, which is we call it papules. Grade three is when you have pus-filled papules, like it's called pustules. Okay, so when you have like very pus-filled lesions, it is the grade three, and which is we call it severe acne. Then we have a grade four, which will be very thick, acne that you can feel it under your skin. So some people will be saying, I feel like I have a nodule in the skin like that. So it will be very thick and very big. So those are the mainly severity. According to the severity, we grade it like that: grade one, grade two, grade three, grade four. The importance of grading is that our treatment depends on that. So basically, it depends on like what kind of lesion do you have? Depends on that. We customize the treatment like that.
Dr. Aslam, when a patient comes to you with acne, do you recommend some test or just by clinical investigation you are sure that, yeah, this is the acne, this is the grade, this may be the root cause?
Again, that depends on the patient. See, if a like very adolescent case comes, we don't usually do blood tests or anything because like it tend to limit itself, and we know it is bound to happen. It's because of the hormone change and all those things. Like in adolescents, like males tend to get more acne than females because the like male hormones, they stimulate the sebaceous glands more, so we tend to get acne like a lot more than women. But when a girl comes after her like 20s and 25, then like if gives us a history of irregular cycles, menstrual cycles, and all those things, then we definitely do blood tests and scans or whatever. Like as I said previously, the main thing to roll out is polycystic ovary syndrome, and a lot of other things. Like in adolescence, you have to rule out a lot of things. You have to rule out diabetes, rule out all those things which can cause acne. So it depends on the age and other symptoms and history of the patient. So if a patient comes in adolescence, we don't tend to do anything. We just treat acne, but depends on the patient. Yeah.
And doctor, what are the treatment options? What are the procedures available for acne management?
Okay, so basically it depends on the grade. As I said, like if it's a very mild grade, then we can go with only topical creams. There are some things called retinoids. Like you must have heard tretinoin, all those things, triflurotin, the newer one, and all those things are there. So basically, those are retinoids which we can use when it is very like small comedons, bumpy lesions, and all there. But when you get a lot of pustules, pus-filled lesions, we have to switch to an oral antibiotic also. So we generally use doxycycline, azithromycin. Then, if it is not like if it is a very grade 3, grade 4 acne, which is not responding to even oral antibiotics, then we tend to use isotretinoin, which is something, which is a like kind of we keep it for last because it has a tendency to create a lot of dryness and all those things. Basically we try to keep it with only like control it with topicals like retinoids, benzoyl peroxide, clindamycin, all those things are there. So basically topical and oral antibiotics also. So basically usually what happens is it's the combination of all these things that works so individually. So these are the options and procedures. If you ask me, like there's a procedure called comedone extraction, okay, which we can remove individually the comedones. Then there are peels. There are chemical peels which work really well in acne. There is one peel called black peel, which is very kind of useful in acne. So basically, those what they do is they tend to limit the oil secretion of your face, and then they like reduce the occurrence of acne. So yeah, peels, then comedone extraction. Those are the two major procedures that we do regularly.
Those people who are prone to have acne, or who had acne, they know how difficult it is to take care of the marks and the scars. Treating acne is one thing, treating the marks and scars is such a big challenge. So, do these procedures you mentioned, peels, etc., they also work for marks and scars?
They work for marks for an extent, but not for scars as such, because scars are basically like, for the scars to go. First thing to treat scars is how to treat scars is first to treat acne. There's no point in treating the scars without treating acne. If you still have acne, then you tend to get more scars, right? So you have to treat the acne first, then go to the pigmentation and scar part. So for the scars, what we tend to do is there's a laser treatment called CO2. We can use the lasers, we can use micro needling, and all those procedures are there. So these tend to create small injuries in the skin. So if there is an injury in the skin will heal, right? So basically, that is the whole principle behind it. So we have to do procedures like lasers, micro needling, and all this MNRF, micro needling, radio frequency. All those procedures are there, which are very useful in scars. But pigmentation, yes, for an extent, peels will help.
Okay. And after, as you mentioned, these procedures and all, what kind of role does sunscreen plays in after these procedures or when you are treating the acne? Are they equally important?
Sunscreen is one thing which is important always. Okay, so like if people ask me like I can only use one thing, I say use sunscreen. So that is the only one important thing which you cannot like kind of stop. So even after procedures, it becomes more important because after any procedures, after peels or anything, your skin becomes lot more sensitive. So at that time, use of sunscreen is pretty much important. So use of sunscreen is very important according to your skin. So if you're very oily skin, use of a very oily oil containing oil based sunscreen not recommended. So nowadays, like we have a lot of good sunscreens, which won't make your skin very oily and which won't even feel like a sunscreen. So a lot of sunscreen options are also there. So sunscreen, yes, very important. You have to use a proper cleanser according to your face type, your skin type. Then you have to use a moisturizer. An oil control moisturizer will be ideal. Then hyaluronic acid based or like a good moisturizer and a good sunscreen. Yeah, those are the three like minimum things that you have to use.
And people with acne, can they use makeup?
Makeup like as such, like for anyone, I wouldn't recommend. So but some people, they have to use it because it's their
Right.
professional requirement and things like that. So for that, like for them, I will say like stick to one brand. And like there are a lot of non-comedogenic makeups available. There are like medical grade makeups available right now, so like very non-comedogenic and without any oil or all those things. Those are the only things which is recommended, but I won't say recommended because if you can't if you can stop using it, yes, better to not use it. But if you have to use it, yes, then you have to stick to one like very non-comedogenic and
Hmm.
mild makeup, and then make sure to remove it as soon as possible. So don't
Right.
sleep with it, definitely, for sure. Yeah.
And so far we were talking about what to do. We would also like to talk about what not to do because people have this tendency of touching their face again and again, or popping out, squeezing their pimples, or then we don't clean our makeup brushes that often. So how important it is to take care of these things as well.
See, if you pop the pimples, the thing is you will end up getting a scar or you will end up getting a like pigmentation over there. So it's better to leave it alone. Okay. So, some people get very like very nodular, very, very hard kind of lesions. For that, we do some other procedures also as well to remove it. But don't remove it like, by squeezing it or things like that. It will always result in a scar or a pigmentation. So better to avoid all those things. And frequent, like we have a tendency to frequently touch the face. So I don't know, like it's a thing within, like with us. So basically the thing is we have to apply sunscreen regularly, like at least 4 hours, we have to reapply your sunscreen because you frequently touch your face and remove your products. Other things are like basically one good thing to look for is the diet. Okay, because diet may not have a big role in acne, but some things like we call it very high glycemic index diet that will which will like increase your sugars pretty quickly. So desserts and all ice creams, chocolate, all those things, try to minimize all those things and fatty foods and all those things and dairy based
Many
products.
times people say, yeah, dairy. I wanted some
Yeah.
clarification on dairy
Yeah.
products.
So dairy basically, see, previously it was thought that a lot of things are causing acne, but right now, like the only thing that we try to tell patients to not to avoid, but to limit is basically dairy products and high sugars. That is the only thing. Yeah.
Okay, so we need to avoid dairy products and high
Not avoid
sugars or high glycemic.
completely. Avoid is not the right word. We have to like control the usage. That's it. We cannot avoid. Yeah.
Right. And Dr. Aslam, before we wind up, any take-home message, any do's and don'ts for our viewers?
See, nothing. It's basically you have to keep your skincare routine like pretty simple. don't layer too many products. Like when you see a lot of things through the reels and everything, don't layer too many products. Like when we talk to people, like what they're using, everything they're using niacinamide, they're using vitamin C, they're using retinol, everything. Like 22-year-old girl using retinol and everything. I mean, it's not like using everything is not recommended. It's up to your up to your problems and up to your skin. So it depends. Everything depends entirely on that. So get an expert opinion. Get the proper skincare routine, which will also help reduce acne. So get a proper skincare routine and keep it simple and be consistent with your skincare routine. And if you have acne, get it treated properly and don't try all those home remedies and things like that. If you have like a late onset acne, you have to get it checked.
By not falling for home remedies, influencers, or over the counter topical applications, we are going to save energy, money, time, and most importantly, our health, our skin. So, in case you need anything, please go to the right person, which is a dermatologist, in case it is associated with your skin or scalp. Thank you so very much, Dr. Aslam. It was wonderful talking to you. Thank you for your
Thank you
valuable
so
time
much.
and
Thank
this
you.
very informative and
Pleasure. Pleasure.
interesting
Thank you.
session. Thank you.
Yeah. Thank you.
Thank
Pleasure.
you, Doctor. And viewers, thank you. Have a great day ahead. Stay happy, stay healthy, and stay strong.